Welcome community, and I'm Melissa Spilsted from Hypnobubs and Hypnobirthing Australia, and I'm very honoured to be here in my backyard with with Stig Severinsen. And
Hi.
yeah, Stig's a world expert in breathing, and as everyone knows, that's what we do. We make sure that we use effective breathing for our pregnancy, our birth, and then for general well-being and health throughout our lives. So I thought, well, who better to get to teach us go through a little bit of an exercise and give us more of an understanding of the importance of effective breathing for general health than Stig. So over to you, Stig.
Yeah, well, hi everyone, and of course, first of all, we have to recognize the importance of breathing. It's what's keeping us alive, it energizes us, it's related directly to our blood pressure, the way the heart is functioning, the way our mind is functioning, and even if you're going to spirituality and love, it's all connected, and the way we breathe is the way we live, right?
Yeah.
It affects us when we're stressed and tense. We're up here. When we relax, we're composed and happy. It's all down in the diaphragm, and we have this good feeling of relaxed and a relaxed state of well-being. And the trick, I would say, mostly is to be conscious.
Yeah.
Be aware of your breathing. And this is probably the most overlooked thing in our modern world, that we have access to this breathing 24/7, yet most people don't pay attention. So the breathing gets ahead of you. So that's a problem. It's not just a challenge, it's a problem, because then you are ruled by circumstances, and often in stressful situations, the breathing gets the better of you. Whereas if you take control in a kind and simple way, then you decide how your body's functioning and how you're responding and reacting to stresses from the outside environment.
So this is
So
very
it's super
applicable.
simple. Yeah, to
this
anything
is-
in life.
Absolutely, but during pregnancy,
Of
so
course,
we have
during the most important event in life, when you're
Yeah.
giving life
That's
and
it.
preparing life, just the connection with the baby, just knowing that you can actually affect your heart rate. If you exhale slowly, I always tell people the key to relaxation is in the exhalation. So when you trigger that vagus nerve, the 10th cranial nerve that makes us relax and calm down and feel good, because we tap right into that part of the nervous system that's called rest and digest, then of course the little baby is feeling more relaxed, the heart rate goes down in the mom, so that intimate connection is emphasized, and the baby feels more safe and relaxed as well. So there's a direct way to actually communicate with your baby that everything is okay. And then of course during pregnancy, there's a million things you can do, but just knowing, I think, the simple fact that you can take control, whether it's for pain relief, without having epidural or any other medication, you can have a natural birth, hopefully. Not always, but hopefully.
But
Lots of studies show that if you do breathing, meditation, relaxation, you can completely, or you can really minimize epidural and other drugs. So there are many studies out there. We're just not making that up, scientific studies. I should maybe say that I'm a scientist or something like that, with a master's degree in biology and a PhD in medicine, but I'm totally into all this breathing and a little bit of breath holding.
Yeah. Oh, I did forget something pretty important that I forgot to mention. Stig is world famous for being able to hold his breath underwater for 22 minutes. I'm serious, 22 minutes. So if you want to learn more about Stig, he has all of these wonderful breathing programs. Go to breatheology.com. I will post that link.
Yeah,
under
people
this
can read
video.
articles or whatever there. But yeah, I'm really into breath holding, and it's because I think we need to understand the breathing process from that 360-degree view. That's what I like to tell people. I like to take them up in the helicopter, bird's eye view, looking down at the breathing process, because there is no day without night, there's no sun without moon, the yin and the yang, and we only focus normally on the breathing. But in fact, if you think about it, breathing is stressful, right? Take a breath with us, whether you do it wrongly, the chest breathing, the mouth breathing, you'll feel dry in your throat, and you can see and feel, more importantly, this stress on your chest. The heart rate goes up because the cavity in here is squeezed, so the heart has no room to really work. And of course you're blocking the diaphragm because you're tensing up all your muscles here. Whereas if you just reverse and do it the right way, the nose is for breathing, the mouth is for eating. The nose is a big filter. It gives the temperature. It adjusts the temperature, whether it's too warm or too cold. It makes it the right temperature and also the right moisture, because you have this inner nose and it's like a climate station. Not to talk about all the viruses and bacteria and fungus and physical objects, dust and such, that is filtered out in the inner nose. So you don't want that to go straight into your lungs. So that's why you don't want to breathe through your mouth.
Okay, so remember that. There's a gem. The nose is for breathing. The mouth is for eating.
Yeah, that's how we're built. That's simple anatomy. And also, nose breathing facilitates diaphragmatic breathing. So whether you know about breathing or yoga or not, it's completely irrelevant. You can just try it yourself. If you do the chest breathing, the wrong stressful breathing, you will feel that it's stressful because you're doing an effort, right? You're burning oxygen and using muscle tension.
It's inefficient.
And you're using the chest, you're using intercostal muscles, but that's not how we should breathe. That's for running and for weightlifting, power breathing, and that's how many people breathe when they're stressed. So that's why it releases adrenaline and these stress hormones and make the heart rate go up, and you're not feeling in a happy place.
And we do not want to be doing that when we're giving birth.
Especially not during birth or pregnancy in general. Of course, another point is that when you are pregnant, there's a lot of space taking up where the diaphragm is, so you have to focus a bit more on the nose breathing because you're already full in here. So it's easy maybe to slip into the mistake of moving everything up to chest breathing. And then also when you're not using the diaphragm, you're not giving that massage to inner organs, and you're not caressing the baby in the right way. So you get kind of locked and blocked up in this region, which can lead to another series of both mental, physical, spiritual issues.
It's amazing
with your emotions and fear and doubt and so forth, because it's all stuffed up here. Whereas if you're more grounded and still keep that connection with the baby and the breathing, then everything is more in control. So it's all about control, but from a gentle place, right? And so through birth, I mean, we could talk about this for hours. Probably we got to stop now. I also got a train to catch up north. Even though I could talk all day, it's lovely. But maybe just ending off by explaining that also during birth, I mean, this incredible power of breathing and knowing that you can actually be in control of your mind. And as soon as you resort back to your breathing, or whether it's mouth breathing or nose breathing, whatever it is, to relax and get in control, just knowing that you can resort to breathing and then connect with your body. And of course, when you have to get the baby out and holding the breath and building up that pressure, getting the muscles to work in a coordinated fashion, all that stems from correct breathing and from pre-work. You have to train and visualize, imagine how it's going to be, how your body's working. If you have a partner, I think it's a great idea to do the exercises together. Maybe your partner can put a hand on the belly, on the baby, and you can put your hand on the chest, right? And you can learn the difference between belly breathing and chest breathing. And you can feel the difference, more importantly. So just having that little warm up and knowing that your breathing can be used in so many incredible ways is a good safe haven. Even though you have never done breathing before. So play around with it and have fun. That's what it's all about. And all the best on your upcoming baby.
Breathing is life.